Hi, everyone. Welcome to another question and answer session with Dr. Drossman and myself. If you attended DDW this year, you hopefully attended also the Rome AGA lectureship and saw our guest speaking there. And she's joining us again today to talk about a very, very interesting topic, which is cannabis and the GI tract. It's Dr. Venkatesan who is joining us today. So hello to Dr. Drossman and to Dr. Venkatesan. How are you both?
Hi, good, thank you.
Well, welcome, Thangam. For those of you in the audience, Dr. Venkatesan is the Director of Neurogastroenterology and Motility, just starting her role there, and a Professor of Medicine at Ohio State University. So we wish you well there and hope it goes very well for you.
Thank you.
Dr. Venkatesan is an expert in this very popular area now, looking at cannabinoids, which of course is marijuana and gummies and whatever else you want to call it. CBD oil, which is a derivative of that. And so we thought today we would ask a few questions. First of all, let me ask you about what is the effect of marijuana on the GI tract? What does it do to the gut? And does it help symptoms? Let's hear a little bit about that.
Yeah, thank you, Dr. Drossman. And like you said, really marijuana or cannabis is obviously being legalized in so many different states and people are using it. It does have several effects on the GI tract, and it has effects on the stomach, and it has really a huge role in nausea and vomiting. So it does affect a lot of systems. And even though we're talking about the GI tract, marijuana actually acts on something called cannabinoid receptors. So you have cannabinoid receptors type 1 and type 2. And more importantly, really, you have, cannabinoid receptors type 1. And as we know, there's a brain-gut connection, right? And so these cannabinoid receptors are densely distributed in areas of the brain that are very important for nausea and vomiting. And like I tell my patients, hey, you're vomiting, but the center for nausea and vomiting is your brain. And so cannabis acts on these cannabinoid receptors. And so typically what happens is that, and there's also a variation between what a low dose of cannabis does and a high dose of cannabis. And before I go into actually the, really the effects on the GI tract, I want to just talk, give you a few basic facts about cannabis that I think everybody should know. So one of the things is, as you know, cannabis comes in different forms. There are edible forms, there are smoked forms. And the most common way of really using marijuana is smoking it. But, the devil is in the details. So if you're going to just smoke a joint, the amount of cannabis or marijuana that you're getting in your body is very different if you're going to, say, vape what is called cannabis concentrate. So any patient should know the difference. Like, you need to know what you're buying and what you're using. So if you're smoking a joint, the amount of what we call THC, or an active ingredient in a joint, can be maybe 15%. But if because of really the way cannabis is like manufactured these days, you can get cannabis concentrates, like it's called amber or shatter or wax, because it looks like that. And the amount of concentrate, amount of THC in those can be really as high as 85%. So it's sort of a loaded question when you say, what are the effects in the GI tract? It depends on what you're using and how often are you using it. So if you're going to use, say, a joint, maybe once or twice a week for aches and pains or stress, that's very different from how it's going to affect your body if you use, say, cannabis concentrate and you're having either daily or near daily use. So first I want to separate those two really aspects. Are you an occasional user, and are you using products which are really low in THC? And are you a heavy user? And heavy use is defined by most of the part people, if you will, as daily use or near daily use. And are you using really kind of these high potency cannabis products? So if you're going to use those high potency cannabis products, yes, you will likely have adverse, problems with the way it affects your GI tract. If you say use low doses, it may even help your nausea. It can, increase your appetite. So people say, hey, it improves your munchies. And it does actually, at least patient reports, really suggest that it reduces stress and so on. But then on the other hand, if you're going to use it daily and you're using these products with really high concentrations of THC, then, the GI tract, you may actually it may lead to nausea and vomiting, or, we know what is called cyclic vomiting syndrome, or exacerbation of cyclic vomiting syndrome if you're a very heavy user. So, and then it also affects your stomach. So it can affect the emptying of the stomach. So your stomach actually can, kind of empties a little slower. So these are some of the, kind of the main issues that come up when we talk about effects on the GI tract. Certainly it can, it does have effects in the colon, but I don't think that they're that pronounced that patients necessarily come to you with symptoms. But as we know, the GI tract and the brain is intimately kind of connected. And a lot of people with GI disorders also may have what we call coexistent disorders like anxiety and depression. And so they may be treating all of that. So, what I'm going to say is that I have to qualify my answer a little bit by saying that if you're going to use, cannabis occasionally, you may be okay. And in fact, you may possibly have some beneficial effects. But then if you, for example, like appetite and nausea and so on, but then if you're going to use it heavily, not only does it have, it may be problematic with the GI tract. And again, we need to qualify, I need to qualify my statement a little bit, because unfortunately, there isn't enough research in this area for us to make really firm conclusions and tell you definitively a yes or a no. But I generally would advise patients that first, you need to find out what exactly you're buying and how you're using it. Now, the other thing in terms of the effects of cannabis, I didn't touch upon the edible products. So when you look at edible products, you really need to be careful. Now, however, edible products do have a lower bioavailability, so they tend not to be as potent as something that you smoke. There's clearly a lag time between the effect of the edible product, versus anything that happens to your body, as opposed to smoking, where you just have it in like a few seconds or a minute or minutes. And again, edible products can actually, more than the GI tract, they can sort of really affect the way you think or cause problems with confusion or even respiratory depression. And I know of people who've been tricked into thinking, they're regular cookies and they're laced with marijuana, and they land up in the emergency room. So I do have some stories, of say mothers not knowing that their sons are having, marijuana cookies, and then, hey, the next minute they're in the ER and the son gets a earful saying, hey, never do that to me ever again. So I think, it's interesting, but this is how I would kind of answer your question.
It's very valuable, because I think we do have to separate out the recreational use from the more constant use. Also, correct. I think, when I was in the 60s, it was there, but it was a much milder. I think the concentration has gone up tremendously. And the kind of things that we're seeing now with perhaps cannabinoid hyperemesis may not have occurred back then. I don't know, but it was a much milder form. Maybe we should also separate, because out there in the world is also CBD, cannabidiol, and THC. Can you differentiate that for us?
Absolutely, that's a great question. So again, like you say, whenever you have cannabis or marijuana, the most important ingredients, it has a lot of ingredients, but what we're really concerned about is what we call THC or tetrahydrocannabinol, and like you mentioned, CBD or cannabidiol. One of the important things about CBD is that it actually lacks or does not have what we call the psychotropic effect. So CBD, pure CBD, will not give anybody a high. And it can be used, I feel, more safely. Obviously, we don't have really a whole lot of studies in GI disorders with marijuana or CBD and THC. So that needs to be teased out. But in general, I would say CBD is a little safer. And like you yourself pointed out, this whole concentration, there's a ratio. When you take the plant in its sort of natural form, there's a certain ratio of THCs to CBD. And there are studies that show that things have really dramatically changed since 1990. In fact, when they looked at samples and analyzed samples, they found that the concentration of THC in a joint went from 5% to 15%. And the CBD actually went in the reverse direction. So you're really kind of altering the natural properties, of a plant, and you're really kind of changing the way it works. So I think if I would, again, there isn't that much of data, but at least based on what we know, I think CBD in general would tend to be safer, for various uses versus kind of high concentration THC or THC. That is a very important separation that you make, Dr. Drossman.
Well, let's then move into medicinal, Marinol. Tell me what that is and how that relates, because patients will say, can I take Marinol instead of marijuana?
Right. So again, that's a good question. And again, so the issue with, Marinol is obviously it's something that's manufactured and clearly it's, approved for use in mostly nausea and vomiting related to chemotherapy. And again, like I said, Marinol is an oral tablet, so the bioavailability is going to be a lot lower. So if somebody is going to switch from a joint to Marinol, they're not going to be happy. While Marinol does have data that it helps with, nausea and vomiting in certain circumstances, I'm not sure there's enough data really in, other conditions. There are a few studies here and there, but I don't know that it's necessarily has shown great therapeutic benefit in GI disorders. So I think the word is really out yet, and we really need more studies. But I will say that because of the low bioavailability and the way it works, I'm a little skeptical that it would actually work in various GI disorders.
I think that, I guess moving on, the spectrum here is where the overuse can lead to chronic nausea vomiting syndrome or chronic cannabinoid hyperemesis. Can you tell us about that? How it might cause adverse effects?
Right. Well, gosh, you're poking the bear now. So as far as and I think this is a very controversial subject, and we've looked at this extensively. And for our viewers out there, I think cyclic vomiting syndrome is really a condition where you have phenotypic episodes or recurrent episodes of nausea and vomiting, lasting anywhere from 1 to 7 days. You kind of go back to baseline in between, and then it's like a rerun of a bad movie. So you're going to have the same episode over and over again. And strangely enough, in about 2004, there was actually, he's an internist, and his name is Alan, and he practices in the Adelaide Hills. And he found that there were actually a lot of adolescents, and he studied about 18 patients, and they were heavy users. And he noted that they would kind of have this hot shower bathing. And he was able to follow, and that's actually the best study with cannabis and vomiting so far, really. And so he was actually able to follow 9 patients for at least 1 or 2 years. And he found that as they reduced their, cannabis intake, their vomiting seemed to get better over a year or so. And to this day, I would really quote Allen's study really as the best study, not so much because of its numbers, which are low, but because he actually clinically observed and followed these patients for a period of time. So, one of the things is cannabinoid hyperemesis syndrome a distinct disorder, or is it a subset of CVS? And at least, we published the guidelines and we did a systematic review on this. And we really do believe, and I believe that at least based on the data and the evidence and my practice of seeing more than, 1,600 to 1,700 patients in over 10 years, that it is a subset of CVS. And I feel that chronic cannabis use probably unmasks cyclic vomiting syndrome or makes the CVS of vomiting worse in patients who are genetically predisposed to this condition. So at least that's what the data suggests, because I've looked at studies. We did a study of, say, about 140 patients, and we looked at them, and we found that really we didn't even detect one case of CHS. There was one person who quit cannabis, and then he became okay. But then he resumed cannabis, and he used cannabis with a higher ratio of CBD. And this person remains symptom-free to this moment. And I know a lot of people who have quit for many months, but then they continue to have the vomiting. So I think our understanding of what CHS is and the relationship between chronic cannabis use and CVS and CHS will continue to evolve. But almost all of the publications out there, unfortunately, there's a considerable variation in how they even diagnosed CHS. And thanks to you and the Rome Foundation, y'all finally actually, it was great that y'all finally said, okay, these are diagnostic criteria for CHS. And if you look at the entire body of literature, and it's not that it's necessarily their fault, they just use different definitions, to make a diagnosis of CHS. So there was really no uniform way where they describe CHS. And I think it's important as we move forward to use the Rome criteria, maybe add revisions as our knowledge about this improves, to really understand and characterize these patients to see how it is. But be as it may, I think based on both my clinical experience and the data, I do feel that chronic heavy cannabis use can make cyclic vomiting worse. And really trying to make the patient understand what cannabis could potentially do to them in a non-judgmental manner, because most people are dismissed. The minute you say cannabis, they're out. And, unfortunately, the physician or whoever is sort of approaching them literally tells them that they will not see them till they're cannabis free. And I think that's a ridiculous statement to make. And that's not how medicine works. So I think it's complicated. And we need more data, but if I had to summarize it, I would say that CHS at this point is probably a subset of cyclic vomiting syndrome, and then certainly that chronic heavy cannabis use can potentiate it or unmask it in patients who are genetically predisposed.
And the demography is the same. It's often young males who are chronic
exactly
heavy users. But I think the message for the clinicians is, if they are smoking and they have this, they have to go off completely. We're not talking about cutting back, right?
So this is again, you're obviously the guru of this, and when you tell somebody, I think it's really a physician-patient relationship, and if somebody is smoking very heavily, you have to decide, whether they have a serious problem enough that they have to, say, seek help with a specialist in addiction medicine. And if you think that's not the case and you make that clinical judgment, what I tell people is, hey, why don't you at least try and cut down first? If you're doing it 6 times a week, let's try, why don't you go to 3 times a week? And I say, go and find out what you're using. Ask the person, how much of THC is there? Why don't you try maybe, using a lower potency product for sure? I definitely tell them to stop any cannabis concentrates. I think that's important. If it's a regular joint, I do tell them try and cut down. And again, I think it depends on an individual patient. There are some patients who say, hey, I'll quit. And they have quit. So I think it's, you sort of make a judgment call based on your patient. But I do think that, certainly at least telling them to cut down significantly, if not completely stop it. And the other, really point I want to make is it's not enough if you stop for 2 weeks. Cannabis actually is stored in adipose cells. And so it can take up to 2 months for you to clear the cannabis entirely from your body. And so if you really want to see the effects of how abstinence or even reduction of cannabis, you need to wait a long period of time. Cannabis causes what we call down regulation of cannabinoid receptors. I don't know if you, for the viewers, if they remember, the cannabinoid receptors are densely distributed in the brain. And funnily enough, the more cannabis you use, those receptors are falling off. So your field is, like a scorched earth, and you want all of those little, all these receptors to come back. And based on what we know, I don't think it's going to happen overnight. It's going to take a few months for all of those things to repopulate. So, that would sort of be the discussion I have with a person.
Yeah, and of course, the dilemma is that they're using it sometimes because it helps them, presume it helps the nausea vomiting acutely while they're down regulating. What about the people who don't have cyclic vomiting, but who have chronic nausea vomiting syndrome? Are we talking about the same thing here, that the cannabis
right.
is affecting that?
Yeah, I would tend to, again, I feel that, all of these disorders, and obviously we're talking about phenotypic descriptions, and at some point we'll learn more. But I would tend to actually approach it the same way with regards to the cannabis use. And I would again tell them that they need to actually, one thing I am very clear about is that they should stop cannabis concentrates, which are very high in THC, and reduce or quit. And then certainly I would treat them, because a lot of a mistake that many say physicians who are, let's say less aware of this and don't see it as much in their practice, is they tend, really to take this sort of black and white approach, and they don't give their patient adequate medications, whether it's going to be neuromodulators like tricyclic antidepressants, or is it going to be a newer medication like aprepitant, which is an NK1 receptor antagonist? And so I think there are a lot of medications, and I think it's important to tell the patient, hey, you're going to do this, and we're also going to do this. And, not leave the entire onus on them, because I feel that we do not have enough knowledge at that time to categorically tell somebody that it's all going to be okay if they stop quitting, if they stop the cannabis.
That's a very key point. I think doctors get a little bit anxious in treating this as well, not feeling they can do it. And so they dismiss the patient, but the use of neuromodulators and working out a program and referring them to a psychologist who might work on this is really the way to go. You mentioned aprepitant. It's extremely expensive, isn't it?
Yes, it is. And, it's kind of unfortunate. I hate to say this, the amount of funding that's there for cancer. And so, unfortunately, the insurance companies, deny it. But there are studies and using aprepitant in gastroparesis. Certainly, we looked at the data. There's a small study in cyclic vomiting syndrome, actually out of England. And the guidelines, the American Neurogastroenterology and Motility Guidelines, we have clearly stated that aprepitant should be used in patients with, refractory cyclic vomiting, refractory cyclic vomiting syndrome. So I do think that perhaps that should be used, maybe not as a cudgel, but it certainly, kind of point out to the insurance companies that this is a recommendation that, really the GI societies have made. And if they are denying that, then they're really denying the patient a medication that can be very useful. And I do want to make an important point here that aprepitant is very well tolerated. It doesn't have the side effects that are associated with maybe some neuromodulators, for example, amitriptyline. While some people tolerate it well, as we know, at the higher doses, weight gain. Weight gain is a huge problem, dryness of mouth, constipation. There are so many other issues. And so I think if we are able to use a medication that lacks all of these side effects, I think we're really going to improve quality of life for these patients.
Thank you. I think we're running out of time. We covered a large amount of information. I hope this will be helpful to everyone. So I want to thank you again for doing this and turn it back to Johannah.
Yeah, great.
Thank you so much for having me.
Such good information. Thank you so much. This is such a timely topic too, so we appreciate your time. If you have any questions about the use of cannabis and the role of it in GI conditions, please send us an email or a message. We'll pass those questions along to Dr. Venkatesan and get those answers for you. As always, have a great rest of your day and weekend, and we'll see you next time. Bye, everyone.
Bye, everybody.
Thank you. Bye-bye.